Hello, this is Dr. Wells with Wells Medicine. And PMDD, or premenstrual dysphoric disorder, is a condition that I see a lot of young women for, and some middle-aged women too. So PMDD is a severe form of PMS, or premenstrual syndrome, that occurs because of an imbalance of hormones. There is not a lot of scientific study around PMDD, and there are a handful of treatments that have been successful. And so I wanted to talk about some of the supplements, some of the various forms of treatment that have been research studied, and how we use ketamine to help with PMDD. As women, we are very cyclical creatures. So one of the important things to remember about PMS or PMDD is that I strongly believe that as women, we're not 100% every day. During the ovulation phase, we can be 110, 120%. But during the luteal phase, the phase after ovulation, but before menstruation, where our body realizes that this month an egg hasn't been fertilized, and that we're going to need to go ahead and shed that uterine lining and prepare to try again next month, all of our hormone levels fall, and our mood can really take a hit as well. During that time, women are often, between 60 to 70% of what they can be during a baseline part of their menstrual cycle. So 110% during ovulation, but maybe 60 to 70% of feeling good during that luteal phase. So there are some typical medical treatments for this. For example, if it's severe enough, sometimes doctors will suggest an oral contraceptive pill to level out the hormones. And often they'll do that pill on a 3-month or 6-month cycle versus having the woman cycle every month. So that gets rid of several instances of decreasing hormones throughout the year. So a woman would only cycle maybe 4 or twice during the course of that year. And that would be something to get from the OB-GYN or a PCP. You can also, if it's severe enough, use a hormone blocker entirely, basically initiating a menopause. So that would be a pretty dramatic change, but some women prefer that to the cycling of regular hormones or hormonal contraceptives. And often that would be offered to women that have other symptoms as well, like excessively heavy periods, or endometriosis. That would be a good option for them to look into. And for psychiatry or PCPs, they can offer women a medication like an SSRI during the entire month, or an SSRI only used during the luteal phase. So that's 7 to 14 days during PMS or PMDD and the menstruation period. Now, I know a lot of people really believe that SSRIs take about 6 weeks to work, but for PMS and PMDD, it does seem to be effective just taking it during the luteal phase. So there have been some SSRIs that are approved for that luteal phase. And sometimes it's as easy as, if you're already on an SSRI, doubling the dose during that luteal phase. So that's something, to consider talking with the prescribing doctor of your SSRIs about, is either taking it just during that luteal phase or doubling it during the luteal phase. Some of the more holistic treatment methods can include calendaring out your PMS and PMDD and changing expectations of what you're signing up for or able to accomplish during that 5 to 7 day period. So it can be as simple as being aware that you're really not going to feel well, so that it doesn't take you by surprise or hit you like a train coming in, and so that the people around you who care about you are also aware of mood changes during that period. That can be really helpful, not signing up for volunteer activities, not signing up for that extra project at work during that time, giving yourself more grace and leeway to need sleep, to need better food, to change maybe caffeine levels during that period, to increase some supplements for sleep during that period, or increase some adaptogen supplements during that period. But it can be just really helpful to know and expect that that period is just going to be one you're going to need extra grace and allowance and forgiveness for. There are some supplements that work really well during that period. So starting with the supplements that you would need to take all month in order to help with that time period, there is a super cruciferous vegetable supplement called DIM, D-I-M, and that is something to consider taking all month. It's not something that works just in the luteal phase. But the cruciferous vegetables suck up extra estrogens. DIM has been used for hormone-sensitive cancers, like testicular cancer, prostate cancer, breast cancer, ovarian cancer, but it's also really good in regulating the estrogen balance across the month. Some people will notice a difference in their hormonal acne. A lot of patients will notice a difference in their flow, decreased length of flow, decreased amount of flow during their period, months during that they're taking DIM. And it does seem to be somewhat effective for balancing out the mood symptoms as well. Another supplement that seems to be helpful all month is magnesium, both for helping balance your sleep, for helping with relaxation and adapting to stress levels. But magnesium can be another good alternative for taking all month. One of the recommendations that I see a lot in the literature is calcium carbonate. But I find that this is very difficult for a lot of women to take due to its very significant constipation. So calcium carbonate can be good, but I'm reserving judgment on it because of its significant constipating side effect. I strongly recommend balancing out sleep with extra melatonin, hops, valerian, chamomile, lavender during this time period, because sleep is one of the things that patients generally tend to find very difficult during their luteal phase. And if your sleep is difficult, it's going to make everything else feel very difficult, and it's going to make you very reactive and not resilient for any other challenges that come up. So optimizing that sleep, really blocking out the time for it, making sure your sleep routines are good, and then taking some of those sleep supplements can be dramatically helpful during that time period. St. John's wort, if you're not already on SSRI or medications that can affect the serotonin system, but St. John's wort during that time period can be a good supplement. Very easy to start, very easy to stop, and readily available. And then other things that are just basic for mental health, making sure that you're not anemic, which if you're having PMDD and a very heavy flow, it's very easy to get anemic within a few months. So making sure that you're not anemic, making sure that your B vitamins are, really up to par levels. So that would be B12 and B9 folate, which are very important for anemia, and B6, which is excellent for creating serotonin and for mental health. But B vitamins can be very important for just basic mood, but especially important during PMDD. And then vitamin D, that one's always important for mood, and I think it gets left behind a lot when we're talking about PMDD. But if your vitamin D levels are low, you're not going to have a good mood, and that can be especially true during PMS, PMDD. So a lot of patients will come in to see me for depression, irritability, anxiety, and when they start feeling better, somewhere in the 3rd to 4th ketamine infusion, or on the 3rd or 4th day of TMS, sometimes they'll start to notice that their mood is great, except for 5 to 7 days a month, right before their period. unfortunately, ketamine doesn't help PMS, PMDD. Hormones are hormones, and I think helping with the hormones is really a struggle that many women face, and there are lots of supplements and alternatives to help make that time period easier. Ketamine can make it easier as well, but hormones are going to be hormones, and I think those need to be addressed before patients are really going to feel optimal all month long. So that's just a little bit about PMS and PMDD, and some supplements and some prescription medications to consider trying, and hope that helps.